Hello, everybody. Welcome to another class of Intracranial Radiology for anesthetists. Today, we will be covering the section of arterial architecture inside the brain, a little bit outside, mostly inside. So, let's just jump straight to it. I'm going to share my screen now. All right. So, here I have a case of the vertebral artery dissection. But let's just at least let's have a brief discussion before I jump onto the CT scan part. So the thing is, inside our brain, the arterial anatomy is divided broadly into two parts. One is the anterior circulation, one is the posterior circulation. The anterior circulation is comprised exclusively of the two ICAs, the two internal carotid arteries. Okay. So inside they will go ahead and form the ACA and the MCA, the anterior and middle cerebral arteries, which will then supply the respective jurisdictions. Okay. Now the posterior part of the circulation is formed by the two vertebral arteries which join to form the basilar artery and then eventually go on to form the posterior cerebral artery. Now, these anterior and posterior circulations are theoretically connected by the posterior communicating artery, which joins the PCA, the posterior cerebral artery, with the terminal portion of the ICA. Okay. Now, why I say theoretically is because PCOM, the posterior communicating artery, may not be there in all patients. Okay, it will be there in a few patients, and rarely will you be able to see both the posterior communicating arteries. Now, all of you have heard the term of Circle of Willis, which basically comprises of, from the posterior part, let's start. Okay. So you've got the basilar, which divides to form the two PCAs. From the two PCAs, two PCOMs going anteriorly, which join with the ICA and the anterior cerebral artery, the ACA part of the ICA, they go ahead and join in the middle to form the anterior communicating artery. Okay, so this entire thing, the ACOM, the anti-communicating, the two ACAs, the PCOMs, and the two PCAs finally joining to form the basilar. This is the complete circle of Willis. Like I said, the complete circle of Willis is not going to be present in all patients, but luckily I was able to find a patient in which the entire circle of Willis is visible. Okay. So let's just start with the posterior part of the circulation and then we will go ahead and study the anterior part of the circulation in the CT scan. Okay. So if you want to study the arterial architecture, at least get an idea of what it looks like in your mind. Okay. You should go ahead and look at the MRI images, which give a much more detailed view of the arterial architecture. Especially you want to look at the T1 scans, which have gadolinium contrast in them and with thinner slices. Okay, so the prototypical sequence that you want to look at for learning this is the T1MP RAGE sequence. Okay, it will usually be there in most patients. In the packs, in most patients, you'll be able to find the T1MP RAGE sequence. It will be usually there at the bottom of the list of sequences. Mostly in the bottom, you'll see three separate. One is the axial, sagittal, and coronal views of the same sequence. Okay, so in that you'll get 1 millimeter cuts, and because of the contrast, you'll be able to see the arterial architecture very nicely. Okay. The other alternative, if like in this case, I could not, the MRI was not done for this case. So because of that, I'm not able to show the MRI. Otherwise, I would have gone with that. In this case, we have a CT angio. Okay, so in the CT angio also, you are going to get the same thing, except it will be a little grainy. Okay, so you'll have to bear with the slightly poor quality of images compared to MRI. Okay, now let's just start. I'll briefly describe the anatomy of the posterior circulation and then we'll go ahead and see what it looks like on the CT scan, on the CT angio. Okay. Now, the posterior circulation is formed by the joining of the two vertebrals to form the basilar. Okay, for that you need to know a little bit about the vertebral arteries. The vertebral arteries will start somewhere here in the neck. Okay, they start from the subclavian arteries. Then they will go posteriorly, okay, and then they will enter the foramen transverse area of the cervical vertebra. Okay. Now the part before the before entering the foramen is known as the preforaminal part. That is known as the V1 or the preforaminal part. Okay. When it ascends up to C2 vertebra, okay, it will ascend through the successive foramen transverse area of all the cervical vertebrae, and this entire portion is known as the foraminal portion or the V2. Okay. After that, it will do a little bit of jugularly, and then it will cross over the atlas. The atlas is the C1 vertebra. Over the arch of the atlas, it will cross like this medially. It will cross medially. Okay. So this part is known as the V3 or the Atlantic portion. Okay. After that, it will pierce the dura at the foramen magnum and go around the medulla and then go upward to form the basilar in front of the pons. Okay, so this last portion is known as the intracranial portion or the intradural portion or the V4. Okay, so again to recap, four portions: V1, V2, V3, V4. V1 is preforaminal, V2 is foraminal, V3 is Atlantic, and the V4 is the intradural portion. Okay, then it will join. It will go to the front of medulla, where it will ascend a little bit up, and in front of the pons, it will join to form the basilar, and then the basilar will go up. Okay. This basilar will travel in front of the pons. Remember always, it will travel in front of the pons and at the level of the midbrain. The midbrain, you remember, is a butterfly-shaped structure. The middle V inside the like the butterfly or the heart-shaped structure. So that middle V in the heart-shaped structure is known as the crura. Okay. The CSF space directly in front of it is known as the crural cistern. Okay. So in the crural cistern, your basilar will split into the two PCAs. Okay, and then it will then basically the PCAs will continue to form the posterior circulation. We'll come to the PCAs after I have shown the vertebral and the basilars in the in this scan. Okay. So how do you recognize the vertebrals? Always look for the foramen transverse area. Inside that, you will see the vertebrals. In this case, this and this. These are the 2 points that you need to focus on. Okay. I'll just play the video slowly. Are you able to notice? These are the 2 points, which are the 2 vertebral arteries, the foraminal portion of the vertebral arteries. Okay. Now you can see it is going out. Okay. After this, the video will slow down a little bit. Okay. You can see how it is going out, both the sides. It has gone out, and then it will loop back over the arch of the C1 vertebra. Okay, sorry. This is the loop. That time it was just going from the C2 vertebra to the C1 vertebra. Sorry, C3 to the C2 vertebra. After that, it forms the loop. So this is the loop of your the Atlantic portion of the vertebral artery. And how do you recognize the C1? The C1 will always be in the form of a will have an arch as its anterior, and you will be able to see the body of the C2 or the dens right behind the arch. Okay, so this is the body of the C2 and this is the C1 vertebra. Right above this, in the above cut, you will find the foramen magnum. Okay, so you can see here it is looping over the arch of the atlas on this side also. And then it is going to meet, going towards the front of the medulla. All right, so this is the medulla, it will go in front. Okay, so you can see it is traveling towards the front of the medulla. Then it will start ascending a little bit upwards. And then it's going to join to form the basilar artery. And it has formed the basilar artery, which is in front of the pons. Okay, I have modified the densities such that we are able to see the arteries and the bone very nicely. So you won't be able to make out much of the brain structures. So you can see that better in an MRI. So I encourage you to go back and look at the same things via an MRI. So you can see that the basilar is going in front of the pons superiorly, from the basilar, multiple branches will come out, like the pica and the ICA and all those branches will come out. You don't need to bother with those. If you want to memorize those branches, just look up basilar branches on Google and you'll be able to find. All right. So we are about to reach the midbrain, and now you have reached the midbrain where you are able to see the PCAs. You are able to see the PCAs here before the splitting off, because the PCAs have split and come a little inferiorly. So you are able to see it in the lower cut. And superior to that, you can see how the basilar is splitting into the two PCAs. Okay. So this concludes your anatomy of the vertebral portion of the posterior circulation. Okay. Now let's go on to the more important arteries, like the posterior cerebral arteries. So as we said, the posterior cerebral arteries will come out from the basilar artery. They will go around the midbrain. Okay, they will go around the midbrain first, little bit anteriorly, then posteriorly as it loops around the midbrain, and inferiorly. After that, it will just terminate in the occipital cortex as multiple branches. Okay, so that is the overall PCA story. Now, there are parts of the PCA just like parts of the vertebral artery. The P1 segment is from its bifurcation, from the basilar bifurcation until the PCOM. Okay, the posterior communicating artery. Okay. After that, the P2 segment is from your posterior communicating artery till the turn, where it makes the turn towards the posterior part. Okay. After that, P3 is the posterior part, and then that part extends until it starts breaking up into branches inside the sulci of occipital cortex. Okay. And then after that, when it breaks up into multiple branches, then it is known as terminal branches or the P4 portion. Okay. So to recap, from your basilar bifurcation to the PCOM is P1. After that, the P2 is from there till the bend. P3 is the posterior portion in which it goes along the midbrain and then into the occipital cortex, and then it divides into multiple branches. The terminal branches are the P4. Okay, so let's just look at that again in this. So as you are able to see, the basilar has split off. It has split off into the two PCAs. And you are in the lower cuts, you are able to see the PCA. Here also, you are able to see the PCA of this side. So after this, it unfortunately gets lost because it just becomes too small to see. The PCA is a very small artery, so it won't be visible very nicely in this image, but you will be able to see it much better in an MRI. So these are the few branches of the PCA. You can see it is going posteriorly, and it is terminating in the occipital cortex here. Okay, so this is your posterior cerebral artery. Now let's go to the anterior circulation. Okay, in the anterior circulation, your internal carotid artery is the main artery that you have to know a bit in detail. Okay, the internal carotid artery is formed as a bifurcation of the common carotid artery. The common carotid breaks up into two branches, the external carotid and the internal carotid. Usually the internal carotid is slightly posterior. Okay, this how you can differentiate between the two, like when you are looking at it on a CT scan or an MRI. Let's just start here. Okay, so here you can see these two white dots. Here you can see these two white dots. These are the internal carotid. The anterior one is the external carotid. The posterior one, the bigger one, is the internal carotid artery. Okay, so usually your ICA will be a little bigger than the ECA. Okay, and usually it will be more posterior. And if you are still confusing yourself, just scroll a little bit up. You'll be able to see the ECA divide into multiple branches here and there and go off, and only the ICA will stay, which will start going into the skull. Okay, so the ICA is has many like it has got a few classifications to break up the ICA into its parts, but we'll go with the simplest classification, which is a 4-part classification. Okay, your C1 portion, your first part of the ICA is the part which is inside the neck. So it is known as the cervical part of the ICA or the extracranial ICA. Okay. Then the ICA will enter the temporal bone and it will enter through the petrous part of temporal bone. As soon as it enters the petrous part of temporal bone, it becomes parallel to the skull base. Okay, so it basically takes a turn and becomes parallel to the skull base and goes medially. You'll be able to see it inside the petrous temporal bone on these cuts. Okay. After that, it will go anterior and medial, okay, on the sides of the cavernous sinus. And then it will loop back on itself again in the superior part of the cavernous sinus. Okay, so this portion is known as the clinoidal segment. Okay, before that was the petrous segment till the cavernous sinus. You can the next part in the other classification, the more detailed classification, there are like laceral portion and cavernous portion separately. Here, the cavernous and clinoid can be said as one segment. Okay, so the cavernous segment is and the clinoidal segment will be able to see as a loop going anteriorly, then coming back posteriorly. After that comes the terminal segment of the ICA, from which you'll have three important branches. This is something which is important and you need to remember. Okay, the first branch coming out of the ICA is your superior ophthalmic artery. Then you have the anterior choroidal artery and you have the PCOM. Okay, so these three portions are these three arteries are important to know as the branches of the ICA before its terminal portion. And at the terminal portion, of course, it will divide into your anterior cerebral artery, which will go anterior medially, and their MCA, which will go laterally. Okay, so let's look at these segments in the CT scan. Okay, so like I pointed out, this is the ICA, this is the ICA. It is blurring out a little bit. You are not able to see it, but you are able to see how the ICA exits. Basically, it gives off multiple branches and then it exits. What you are left with is the ICA here. Can you see these two ICAs? After that, just keep your vision on these two. Okay, so are you able to see it enter the temporal bone? After this, it will make a loop like this. Okay, so it will just keep watching. Are you able to see it became parallel to the skull base? So this is the petrous part of the ICA. Okay, now it is reached on the side of the cavernous sinus. This is the cavernous sinus. Okay, it is now on the side of the cavernous sinus. Now we'll watch it go anteriorly and then come back after making a loop. This is the cavernous / clinoidal segment. Okay, can you see this? It is going anteriorly, it will make a loop and then come back in the superior cuts. Okay, are you able to see this? Let's just see this again. Oh, sorry. Okay. So again, the IC on the side of the cavernous sinus, going anteriorly, and looping back. Here you are able to see the clinoidal loop, and it is coming back. Okay. So this final portion of the ICA is the terminal ICA. This one, do not be confused. The MCA has already broken out, and you are able to see it in a superior cut. Okay. So this is the terminal portion of the ICA. So in this, you were able to see how it, again, I'll recap. Your ICA will start in the neck. Okay, the CCA will divide it to ECA and ICA. ICA will be slightly posterior. It will go up in the neck. After that, it will enter the temporal bone. Okay, it will it will go anteriorly as the petrous part of temporal bone. then it will come anteriorly and superiorly, then it will enter the sides of the cavernous sinus. It will go anteriorly, make a loop to form the clinoidal portion of the ICA. Then it will come back out, go again superiorly, slightly medially, and there it will give up the multiple important branches that I talked about, and then it will break up into ICA and MCA. Okay. So, yeah. Okay, so here you are able to see the classical breakage. So this is the terminal ICA, which is breaking into the ACA in the on the medial side and MCA on the lateral side. Okay. Here also it has already broken up. You were able to see the MCA on the lateral side in the upper cut because the MCA probably went up in this case, and the ACA on this side. Okay. Okay. Now let's go over the anatomy of your ACA and the MCA separately. Now the ACA, like I described, it will split away from the ICA. Then it will come medial, anterior, and superior. There in the midline, it will join to form the ACOM. Okay. The ACOM will not be visible very nicely on a MRI even, let alone a CT scan. Okay, so you just have to take a guess. Okay, this is where the ACAs have come first. This is probably where the ACOM is on a CT angio. Okay. After that, you will see two separate tiny dots of the ACA going anteriorly and superiorly, and then they will loop back over the corpus callosum and break up into multiple branches. Okay. So in this, again, there are a few parts of the ACA. A1 segment is before the ACOM. A2 segment is after the ACOM, but before the bifurcation or trifurcation, which happens right before it crosses over the corpus callosum. Okay, so that is where you get the TACA aneurysms, the distal ACA aneurysms. The ACOM aneurysms will be there at the ACOM part, and the distal ACA aneurysms usually happen where the ACA breaks off. Basically it bifurcates. Okay. After that, it will loop over the corpus callosum. This is known as the callosal part or the A3. And after that, when it breaks up into multiple branches to supply the medial part of the cortex, that is known as the A4. To recap, A1 before the ACOM, A2 after ACOM till the bifurcation, trifurcation, then A3 the callosal part, in which it loops over the corpus callosum, and A4 is the final terminating branches in the cortex. Okay. So beyond this, there is not much to know about the ACA. You know the arterial territory that it supplies the medial part of the cortex. Let's just look at what it looks like on the CT scan, and then we'll move over to the MCA. So let's just start with a little posteriorly, where a little inferiorly, where your ICA will start breaking up. So. Okay. Okay, so this is the ACA of this side. So, oh, you are able to see the ACOM there. That was the ACOM. Okay, you are able to see the ACOM there. Okay, so these are the two ACAs finally. You will watch them go anteriorly as we go up, and then they will start coming posteriorly. But they go anteriorly until the genome of the corpus callosum, and then they come posteriorly over the corpus callosum. Okay. Okay, so you are able to see them go anteriorly. Now you will start seeing them go anteriorly. Okay, so you are able to see them go anteriorly, loop over the corpus callosum, and then come back posteriorly, and that's it. Okay. So I'll just mark it with a mouse so that you are able to follow it much better. Okay, so these are the two ACAs. They are going superiorly. They will start moving anteriorly now. Okay, they are going anteriorly over, and then they loop over the corpus callosum and come back posteriorly, and then that's it. Okay, so that is the story of the ACA arteries. Okay, now let's go back and look at the MCA arteries. The middle cerebral arteries, they start from the ICA, they will go laterally. Okay. And after that, they will have a major bifurcation or trifurcation. Okay. So that portion from the ICA bifurcation till the NCA bifurcation is known as the M1. Okay. After that, the artery will continue and it will loop over the insular cortex. It will go into the Sylvian fissure. Okay. So before it loops into the Sylvian fissure, it is known as the M2. After it has looped, made at the 90-degree turn into the Sylvian fissure, it is known as M3. And after that, it breaks up into multiple cortical branches. That is the M4. Okay. So let's just look at the MCA here. Oh, sorry, the MCA is already gone. Let's just turn it. Okay. Before that, let's focus on one of the sides. Okay, so this is the MCA. Okay, so it has started out from the ACA and it is going laterally. So this is the M1 portion. Somewhere around here, it will have the breakup into 2 or 3 arteries, the bifurcation or trifurcation. After that, it is M2. Okay, then it will go into the Sylvian fissure. You can see this bend, it is going into the Sylvian fissure. This part is known as the M3. You are able to see it very nicely here. It's going into the Sylvian fissure. Okay, so this is the M3 portion. This is the M2 portion. This is the M1 portion. Okay, and after that, you can see multiple branches that will just divide off into multiple small branches, which will supply the cortex. Okay, you are able to see how it's breaking up. Yeah. So this is the story of the MCA. Okay. Now, as promised, I'll show you the complete circle of Willis in this case. And this is a very rare image. So just keep this image in mind to know, to remember how the circle of Willis looks like in real life. Okay. Okay. So the recap. Here you will find the 2 PCAs. Here you will get the ICA bifurcation and the 2 ACAs. And here you will be able to see joining the PCOM, which will break. So this, are you able to see this thin white streak? This is your PCOM on one side. Okay, so this is the PCA and this is the ICA here. The ICA is bifurcated already in this cut at least. In the lower cut, the PCOM might not be visible, but the ICA is there. Okay, so basically it is sloping slightly downwards, the PCOM on this side. Okay, let's look for the other side. Oh yeah, on the other side, I'm not able to see this. This thin white streak basically, which is going in and out of view, that is the PCOM of the other side. This thin white streak, are you able to see this? So this thin white streak is the PCOM of the other side. Now remember that many times the PCOM is more of a potential artery than a real artery. Okay, potential artery meaning that it is there, but it is not contributing to much flow of the blood. Okay, so because of that, most of the times your PCOM may not be visible on angios even. Okay, because it's a very thin artery and it is a very small artery. But in this case, at least you are able to see one side very clearly and the other side a little bit, because it's like in multiple segments as a single dot. It is visible like that. Okay, so this is what a complete circle of Willis will usually look like. Okay, so I hope this class was informative for all of you. We tried to cover the arterial architecture inside the brain as well as getting a visual idea of what it looks like. Okay, so I'll stop the class now. Thank you and have a good day.